Hi, my name is Janice Gonzalez. I'm the Title V Director in New Mexico, and this video is the development and implementation of the Plans of Care, a two-generation approach for mothers and infants affected by substance use. This video will discuss how New Mexico developed legislation and subsequent policies around the care of newborns exposed to substances and Title V's role in that process. So let's get started. As most of you know, there was a federal law that was passed in 2016 called, we call it CARA, but it's the Comprehensive Addiction and Recovery Act. And it was an amendment to the previous law that was called CAPTA. And the CARA law required states to identify and report on the following things: the number of substance-exposed infants born in their state, the number of substance-exposed infants for whom a plan of care had been created, and the number of infants with a plan of care for whom referrals were made to appropriate services, including services for affected family members or caregivers. And New Mexico responded with our own legislation in 2019 that we called House Bill 230, that was designed to bring the state into compliance with the CARA and CAPTA law. But what it also did was it required that all babies known to have had substance exposures were offered a plan of care at the hospital before discharge. So a little bit more detail about what House Bill 230 did. It required hospitals to create a plan of care for any substance exposed newborn and to notify Department of Health and Children, Youth and Families Department that about the plan of care, to send us the plan of care. It also required CYFD to develop rules and guidance for hospitals and insurance companies and other stakeholders. It also said that pregnant women who were known to have substance use or who had disclosed the use of drugs or alcohol would be offered supports through the plan of care. And it also said that a care coordinator would be assigned to each baby and family who was identified as needing a plan of care. The care coordinator is an important piece because the care coordinator ensures that the plan of care is completed and that families receive the needed services and supports. So an important part of our legislation was to clarify that substance exposure in and of itself did not require an automatic report for abuse and neglect. Because prior to this, we saw that that was happening at some hospitals. All New Mexicans are still required to report suspected abuse and neglect when they feel referrals are warranted. So it doesn't say that this cannot be reported as abuse and neglect, but it does say that that the substance use alone does not require a report. So it's at the discretion of the person reporting. So how did we get to this point of having the legislation? We started in 2017 with a collaboration of many stakeholders, and CYFD was the initial impetus for this group, and they brought together, they asked Department of Health, which is where Title V is, to participate, and they brought together our Medicaid agency as well as our managed care organizations, which we have 3. And then, of course, the Title V program, Human Services Department, hospitals, medical providers, families. We wanted to hear from women with lived experience. We had foundations, we had Indian Health Services. It was a big coalition of stakeholders to figure out how we were going to respond to this requirement of the CAPTA law. And one of the very first things we did was we looked at how other states had been responding, and we realized that in a lot of places they had developed what we felt was a punitive response. Over the previous decade, from about 2000 on, the opioid use in pregnancy had been increasing, and many states had responded to that with a punitive approach, prosecuting women, incarcerating pregnant women. And when we looked at that and we did the research on the effects of that, it was clear that the effects of those policies were, as stated here, it was putting up barriers to accessing care because pregnant women were afraid to come in for care. It was causing erosion of trust between parents and patients and healthcare providers. And it actually was increasing the rates of newborns born with NAS or NOWS. So we decided that we didn't want to take that approach. What we decided to do instead was take a public health approach that focused on prevention. And that includes screening for substance use early in pregnancy, as early as possible, and providing supports and treatment services. So there were several steps in developing the policy, and Title V had a role in all the steps. We were key members of the original task force. We participated in the legislative session, giving testimony at the legislature in support of House Bill 230 and helping CYFD with some of the creation of the initial draft of the bill. And then after it was passed, one of our staff members, along with one of the CYFD staff members, well, several of us actually did a lot of public speaking and training to try to get the word out about what the bill really did, what the requirements were, and to get hospitals and hospital staff and MCOs ready to play their part in what the law was requiring from them. And then we also wanted to make sure that we were collecting the data we needed to really evaluate this law and the new policies that we had created to see if they were working and to make sure that there were no untoward effects that we weren't expecting. And we're also in the process of developing webinar trainings because prior to COVID, our staff was traveling all over the state to do these trainings. So we're going to have all that online now because we know that there's frequent turnover in the hospitals and the MCOs and that the training needs to be repeated. So since every state is required to report on these babies who are born exposed to substances, we just wanted to share our experience, and we hope that that you and at Title V and in other states can learn from this experience and see how Title V can help develop policies and be an important partner with your state in this work.